And then I was in Southern California, USA. I was doing my fellowship. And then Northern California, I heard from Dr. Harvey Whitrow. He has a small practice. I flew from there. I still remember it was Valentine's Day. So I met Harvey. It was nice to meet. Yeah, that's Harvey Whitrow, my partner.
I am here today with Dr. Mansoor Zuberi, co-founder and CEO of Comprehensive Psychiatric Services. They are an amazing practice that's based out here in Walnut Creek, California, but has grown to 22 locations and over 130 doctors all up and down the state of California. I've been working with them for years, and it's been amazing to see their growth, their wonderful staff, how happy everyone is to be here, as well as their commitment to quality patient care. And so today I wanted to talk to him a little bit about what that journey has been like and learn how the process has looked and everything along the way. So thank you for speaking with me today.
You're welcome. It's my pleasure to be with you today.
So let's start from the beginning. Tell me a little bit about how your journey in psychiatric practice began.
So this journey is two parts. One thing, why I became psychiatrist, and then second part is why private practice. So became psychiatrist when I was in medical school and doing my internship. So I always like to treat the whole patients, not an organ or a bone or a muscle. I felt a lot of people in discipline, they were great doctors and surgeons and things, but felt like they were just focusing on one thing. So I want to treat the whole person from head to toe. So then I thought psychiatry is the best profession for me to go there. And then I'm glad I chose it. And then when I started doing psychiatry, so during my residency and my fellowship, when I was to go to, after training, I was to go to my practical life. So a lot of people, I talked to them, my senior doctors and things. So unfortunately, our managed care system was like that. The doctors were kind of have a conveyor belt approach, like the good doctors giving a certain slot and you need to do a certain number of patients every day. And but psychiatric patients are very unique patients. So every patient is very unique. Even their diagnosis is same, but they're very unique. So every patient, you need to give them their own attention and you need to be focused. And some patient, yes, may be seen in 20 minutes, but other patient may need it 2 hours. So people who are sitting in administration and managers things, they don't know. The only patients and doctor who are in that room, they should decide it. So I want to be in practice where it's run by doctors and the doctor decided what is the best care for this patient, individualized care. So I thought that time I cannot work in organization where it's kind of more conveyor belt. That's the time I start looking for private practice, how to do and how to start it. And unfortunately, I did not get much information because the doctors I was working with, my teachers and attending professors, they were all in academia. So they all told me, oh, Mansoor, go do practice. You're going to do great. You're going to be great psychiatrist. But I have no clue how to start, what steps to take in private practice. So I start looking and try to find people who can help me to guide private practice and things. And then I was in Southern California, USA. I was doing my fellowship. And then Northern California, I heard from Dr. Harvey Whitrow. He has a small practice. I flew from there. I still remember it was Valentine's Day. So I met Harvey. It was nice to be. Yeah, so the Harvey Whitrow, my partner. And he has a small practice, like 2 doctors. And so he said, okay, we have one empty office. You can come and join us. It's more expense sharing kind of thing. And then from that journey started. And then we kind of, then that time I realized a lot of people are in the same shoes. They wants to do practice. They wants to treat patient, how they like to do that. But they don't have any place and any platform. So that time we founded the new version of Comprehensive Psychiatric Services, where this practice been for doctors. Anyone who comes to our practice, one of us, we give them doctor complete clinical freedom, how they want to practice a medicine. It should be patient-centric care, what patient wants, if patient need. If patient need to be seen twice a week for 2 hours, you do that. If patient need to be seen once a year for 20 minutes, do that. What is the best for patient? We need to provide that. Okay.
So did you have any idea, sitting on the plane, Valentine's Day, going to meet Dr. Whitrow, did you have any idea what it would grow to?
Not at all.
No.
No, so it is we organically grow. So when I start practice and start growing and we start making success. So we have a doctor join, and then from one practice to second location, to third location, and then from Bay Area to Southern California to San Diego to Sacramento. So
What do you think's been the key to that growth or that success?
I think there is a two very important part of them. One thing I think find the like-minded doctors and psychiatrists.
Mhm.
I think so. I was correct. A lot of people in my shoes who like to do practice and provide. Uh, so so we were able to attract a lot of those psychiatrists. So one important thing is that there is no shortage of patients. We want to be treated and seeing patient. But the important thing to find the right people, the right doctors, so be able to attract a lot of doctors. And the second important thing what I think lucky, I found a wonderful group of managers and people who work with me and running the practice. I able to find the wonderful group of the people as my CFO, my director of operation, and all the managers. So I think these like work together. I think we're able to build an excellent practice.
And you've been working with the same people for years. I mean, some change, of course, but a lot of people.
No, yes, yes. So people are there. I think we all grow together, and we made a lot of mistakes. We achieved a lot of success, and I think that's the important part. I think that everyone has the same mission to providing the best care, and also important things. We became big group, big practice, but I think it's very important for me to still run a practice like a small practice. So people who are coming, patients, and think they don't feel is a corporate culture. We want to have a that individual culture for doctors and a staff, and but have a success of a big group. That's important to having keeping these dynamics.
So you mentioned finding like-minded doctors as a key to doing that. How did you do? I mean, what does that look like?
You know, I think it's happened very organically. I think it's a lot of them in the beginning. It was a word of the mouth. Someone doctors doing that, and then they tell there are other people who train with them. Oh, I'm working there. It's great practice. So it's happened from the word of mouth, and then we have developed the team who are able to reach out to doctors and try to do that. And the good thing of our practice, we don't have any mid-level provider. They are all psychiatrists.
Okay.
So that's very important things. And quality doctors, so whoever doctors come, we want to make sure there are doctors are here who wants to really provide good quality care, and that's the main purpose.
Is there anything about the process from where you started today that you regret or would do differently?
You know, if you look at a bigger picture, no, yes, the time to time things comes. You think we could have done something differently? Yes, I think, process, you make mistakes and things. I think if you think something I could have done differently, I think sometime I think's kind of definitely been more practice. I think sometimes things more impulse and more without making want to move things quicker and faster. Okay, I want to do this thing. Let's do it tomorrow. Then taking it slow and take
Mhm.
one by one step. So, but I think that's happened. But I think that's also bring it the passion in growing the practice and
I
things.
That's why you've grown too, because you take action and you do it quickly.
We always, if you're running a business part, you do need to take some risks. So if no pain, no gain.
And I always find it interesting how the I would, if you wanna call it a flaw or the challenge, is always the other side of what you're really good at and what's serving you really well. So the fact that you're, decision maker and able to push things forward and take actions sometimes can lead to some impulsive decisions, but it's tied to your strength.
You're absolutely right. So sometimes that's what you need to have the right balance.
Right, right. Finding the middle ground.
And your appetite to how much risks you can take.
Yes. Well, and I'm sure your team has helped you with that too. They've provided that balance.
No, definitely my team, and also I think the important thing, my biggest advocate, my wife.
Yeah.
So she is kind of from the day one, from the day we took the Valentine's Day flight. So she was with me.
Why should have taken a sacrifice?
Yeah. So she was kind of always guide me and help me, and whenever I have process going, and she's a therapist by profession, she's part of the company. So I always say I have a therapist at home.
That's so great. She said, "We're gonna spend Valentine's Day going to meet Dr. Woodrow together." I love that. That's awesome. What does the future of CPS look like?
So the important thing beside we provide patients care and therapy and medication management and things. So there are other thing. Intervention psychiatry is a big next step in a psychiatry. They call the TMS and Spravato comes. So at this time, we are very much interested in growing our TMS branch. We have a TMS, but we have a 2 locations. It's a smaller growing, but at this moment, we are adding 3 more locations to TMS. So it's going to be in 5, and I think that's things. So my plan is the most of our location they do have a TMS. So it's a good treatment option. The people who don't understand the TMS is a transmagnetic stimulation. So part of the neurons in a brain, the theories in depression, they may not be working as well or not stimulating as well. So when we give them medication, so they create the environment for neurons to work better, but it does not work for every patient. So TMS is stimulating the neurons with magnetic waves, the same waves which use in MRIs. So it's not electric shock therapy. It's not painful anything. So patients come here. We have a machines or chair because TMS patients lay down there. We stimulate, so they need to be done repeatedly every day. We need to do 5 times a week for 36 sessions, and the results are much higher, better than a lot of other treatments available. Like the response rate is 83%. So it's very good. And these are response rate most patients been the treatment resistant depression for them. If you look at that, so the good. So that's a good treatment option for a lot of patients. So we are kind of growing that TMS. And the second goal of my comprehensive psychiatric services, we are kind of in California doing a lot of practice, but naturally my plans to grow comprehensive psychiatric services outside the California. So that is also my goal at this time.
Awesome. Do you think the landscape of private practice has changed a lot from when you started to today?
Absolutely,
Yeah.
absolutely. So I think that's also is important things because there was a time period when there was a lot of doctors, like 1 and 2 doctors, they open their practice and run practice, no matter is a psychiatry practice or dermatology or primary care. But now you hardly see any private practice individual. Usually they're run by big hospital chains. They've taken over that practice. And the trend is last few years, a lot of private equity firms, they bought all those practices and run by that. The downside of those practices, they may be run very efficiently. Private equity people comes and spend a lot of money. But the clinical side is suffering because only doctors can tell how to treat patient and what we need to do. So that is very important. So that is also important for our practice to have a cloud. So it's been a doctor owned practice and run by doctors. So that's important. So sometimes clinical decision and business decision, they can be odd to each other. So if the clinician is making decision, they always give them what is the best clinically, not a business wise. But if the practice is run by MBAs and CAs, so they always think about business wise what is better than clinically. So that is have changed a lot last over years. So that's why we want to keep our independence, and we want to run practice as doctor should run.
So if someone's entering the private practice space right now, would you recommend they join like with other MD, like something like CPS or I mean, I guess how is it different for someone where you were back when you started?
So I think that's getting more and more difficult because have a successful private practice, you do need to take insurance, commercial
Mm.
insurance, and dealing with the big commercial insurance, multi-billion-dollar companies, you need to have a whole army of people to deal with those things. So it's very hard these days. So afford those people, hire those people who deal with it. So you need to work in a group. You need to do that. So I always say it is better to join like-minded people and groups together. So you're able to afford people who are good at that. Like I cannot bill for myself. I need to hire people who are good in billing. I'm not in good billing. I'm good in treating patients and maybe doing CEO kind of work. So we need to hire it. So you're able to afford those people who are good in marketing, who are good in billing, who are good in accounting. So how we can do those people? So you need to work in a groups and make a cloud.
Is there anything if you could go back and give yourself one piece of advice, is there anything you'd say to yourself at the beginning?
I would do this all over again, honestly. Yes, we made the mistakes and things, but the new doctors who are wants to do private practice, very important part, could never run after money. The important thing is to do the right thing. If you're gonna do the right thing, the success will follow you. The important thing, your heart has to be right place. You are a physician and doctor for a reason because you wanna care about the people, you wanna treat them. So, but if your attention is to, okay, how can I make more money and how where I can get a little bit extra money. So you are not in right profession. The important thing is to keep focus on that why this in profession. So if you're gonna be a good doctor out there, success will come to you, follow you. So that's very important thing to be go out, been there and a big good doctor. Everything will fall in place.
Is there any last things you'd like to share just for anyone watching about CPS that we want to put out there?
No, we had a great group of doctors and clinicians. We have all different kind of doctors and psychiatrists, child psychiatrists, adult, geriatric, forensic. So we are a great group of the doctors, and we provide very individualized care according to patients. So for human beings are very, very important to us. So that's very important. And I've been fortunate enough to be able to build this group of the doctors and our staff together. And we are all in this process, all also having fun too. So that's very important.
I love coming here. Every time I'm here, everyone seems really happy to be here. It's a great place to be. So it's been wonderful working with you, and I've loved hearing your story.
You're welcome. And again, you come psychiatric office, you should feel happy.
It's the goal, right? Not something's wrong.
Yes.
No, thank you so much, Dr. Z. I appreciate it.